And now we will move to my friend and colleague, Dr. Yewande Alimi, who will chair the first session, and it is the principles of risk assessment in the context of zoonoses. And this is very important, and it has been outlined and recommended during the Mexico first meeting around 2011. Now, over to you, Dr. Alimi Yewande. Thank you very much.
Thank you very much, Tieble, and good afternoon, good morning, colleagues, depending on where you're joining us from. Excited to be chairing this session one. I'm joined by quite an interesting panel. First of all, I'd like to welcome Professor Dilys Morgan, who is currently a consultant in global health, working at the UK Health Security Agency. She is the One Health lead in the IHR strengthening project. Prior to this, she was the head of emerging infections and zoonoses at Public Health England for almost 20 years. She has been responsible and is responsible for developing the emerging infections and zoonoses portfolio of that agency. Dilys has a strong research background, having worked for the Medical Research Council in Uganda and Sierra Leone for many years, and she's an expert member of several government high-level advisory groups and scientific committees. She's also an honorary professor at the London School of Hygiene and Tropical Medicine. So welcome to you, Dilys. Next, I'm joined by Dr. Ryan Aguanno, who is a veterinary epidemiologist working at FAO headquarters in Rome. He was involved in drafting both the Joint Risk Assessment Operational Tool, as well as the pilots that have been done in several countries in Africa, Europe, the Middle East, and throughout Asia. Today is going to be joining us from Rome, so welcome to you, Ryan. I also have Dr. Armelle Hebert, is a graduate professor of the Pasteur Institute in Immunology and Infectious Diseases. Her specialty is in public health and environmental risk in public development and public development policies. She's been involved in this for over 20 years, working in environmental health innovations and development, which is a critical component of One Health approach. Today, she's supporting and implementing strong engagement strategy and coalition in One Health, One Water, One Health under innovations in monitoring and risk assessment, looking at the water cycle. Ladies and gentlemen, you agree with me that we have a true reflection of what One Health should look like, having experts from all the relevant sectors on this session. So first of all, we'll start with Dr. Dilys for our presentation. Over to you, Dilys.
Thank you very much, Yewande. I'm just going to try and share my screen. Bear with me. Righto, welcome everybody. Hopefully you can see my first slide. I thought not everyone online are risk assessment enthusiasts. So I thought I'd go back and do some basic principles and terms of risk assessment. So risk assessment is just one component of risk analysis. Hazard identification, risk assessment, risk management, and most importantly, risk communication are the other components. A few definitions. I think we all get very confused as to what the definitions are. Hazard is anything with the potential to cause harm, but the presence of a hazard does not automatically imply a threat. A threat is a potentially damaging event or incident, and a risk is a combination of the consequences or impact of an event or incident and the associated likelihood or probability of a harmful effect to individuals or populations of animals or humans. We tend to use impact and consequences or likelihood and probability fairly interchangeably, depending on which risk assessment process you're going to be using. So why do we do risk assessments? Well, basically, there's many reasons: to inform risk managers, to alert and inform those who need to know about the risk in a comparative and consistent way, for preparedness and forward planning, to provide appropriate guidance and advice, often to a wide range of stakeholders, to inform the media, whether we like it or not. The media is a big part of all our lives. And most importantly, to advise policy and policy makers. And in some cases, it's just to provide reassurances that robust systems are in place. Since most emerging infections are zoonotic in origin, taking a One Health approach to infections and incidents emerging at the animal-human environmental interface is crucial. And this obviously includes assessing the zoonotic potential of new animal conditions. And of course, we have a great experience of this in UK when we had variant CJD in humans after the bovine spongiform encephalopathy. A long time ago, but we're still all scarred by it. There are a range of risk assessment methodologies available, and these are just three of the available ones. There is the Human Animal Infections and Risk Surveillance Group, a UK group that has been using risk processes now for at least almost 20 years. There is the WHO and there's the ECDC. But probably most relevant and most familiar to many of you is the tripartite zoonosis guide or quadripartite zoonosis guide. It doesn't quite trip off the tongue quite as easily yet. The operational tool or the joint risk assessment. I think this is what most of us are familiar with and what we mostly use for infections and incidents at the animal-human interface. Another basic background which does cause confusion is the difference between a quantitative risk assessment and a qualitative risk assessment. A quantitative risk assessment requires calculations of the components of risk, the probability and impact are calculated, and it gives a numeric scored, often of unknown criteria going in. It's useful for risks where the data to define the probability and impact are available, but beware of headline figures based on dodgy data. I'm sure many of you are familiar with a series based on a few cases with very minimal data available, and they still come up with 2 or 3 decimal points of precision. So that's quantitative. Beware if the data isn't available. Very good for longer term issues, or the qualitative assessment is much more a useful approach to the risk assessments we are more likely to do, as it's possible to do with limited information. It's easier to outline uncertainties, and it's important to use consistent terms to describe the risk parameters. Basic background: risk is the product of probability and impact. And so the risk of the population for communicable disease is dependent on the probability or likelihood of transmission in that specified population of animals or humans, and the impact should that infection be introduced. Risk may be influenced by the context or the broad environment in which the threat occurs, and this may be political, public, media interest and perception at risk. All of those often affect what might be the most relevant risk analysis. It's more useful to report probability and impact separately. Because obviously a low impact, high probability event is very different from the other way around. But policymakers often want an overall risk. Desist if you can, but sometimes you do get pushed into providing a risk as opposed to a probability and impact assessments. So I'm going to talk a bit about rapid risk assessment because I feel Ryan's going to be covering the tripartite or quadripartite joint risk assessment in more detail in the next session. So I'm going to talk about rapid risk assessments, which you often have to take as a multi-sectoral, multidisciplinary group as things emerge. And these are the emergency risk assessments. So once an instance has been verified as being a potential public or animal health concern, then a rapid risk assessment is undertaken to evaluate the risks to human and animal health. These initial assessments can be complex and challenging. They have to be produced in a short period of time when information is often scarce. Circumstances are evolving rapidly. As soon as you finish one risk assessment, more data comes in, which changes that output. And however, it should still be based on all available information and evidence that is available at the time to estimate the scale. And be clear on exactly what threat, to whom, and where. And I think in the JRA operational tool, this is where the risk framing section and risk framing question is very good, because it does define exactly what the threat applies to. So the outcome of a rapid risk assessment will determine the degree of escalation of communications, whether a response is indicated at all, and the urgency and magnitude of that response if it is, the design and selection of critical control measures, and it will inform the wider implications and further management of the incident. And it should also provide some information to support the management of the incident, prioritise resources, and aid communication. Now, within the risk assessment process, it's qualitative, but you need to communicate risk in a hierarchy of robust and consistent terms. I think consistent is important. If you use a set of risk descriptors, and there are two examples there, there's one that we used in UK, which just has 5 categories of very low, low, moderate, high, and very high. But I've also shown the tripartite JRA, where the likelihood and impact of slightly different descriptors, but it doesn't matter which system you use, but it's consistency is important, because you're communicating these risks to people who may not understand the process. And if you mention minor one day and low the next, they may get confused as to the relative risk of either of those descriptors. And when you do a risk assessment process, it's always best if the group agrees with a risk assessment and signs up to it. For those who've heard me talk before, I'm very keen on, even for rapid risk assessments, you need the evidence, and the whole thing that underpins a risk assessment is the evidence. And therefore, in that case, it's useful to assess the quality of the evidence which underpins the risk assessment. And this should be done based on source design and every piece of evidence you put in. Uncertainty should be identified, clearly documented, and communicated, and the assessment updated in light of new emerging evidence over time. When you're gathering your evidence, expert knowledge, I think it's important to distinguish between expert knowledge based on good research and experience and opinion-based knowledge, because the former is relatively good evidence and the latter may not necessarily be so. Again, this is just an example of how you can assess your evidence. There are lots of formal systems out there for assessing evidence, but none really are applicable for a rapid situation when you have to your risk assessment within hours. Good, satisfactory, unsatisfactory, and you can see there the sort of evidence that would classify it into those 3 groups. And all of this leads to your confidence in your risk assessment, because if you're doing a risk assessment which is going to be acted on, used by policymakers, resources committed to it, it's useful to indicate how confident you are of the evidence that backs that risk assessment up. The JRA operational tool uses uncertainty here, which I think can be confusing. In some trainings we had, I think people have had problems with uncertainty, but it's another term you can use instead of confident. So this is how certain you are that your risk assessment is accurate portrayal of the risk. This is again 2 summaries of the quality of the evidence. If in the human animal infections risk surveillance group. This is the evidence that we categories that we used, and that is how we assessed it. So if most of the evidence was unsatisfactory, then the confidence in that risk assessment is unsatisfactory. For the JRA operational tool, again, they've got a slightly different categorization of their uncertainty. Whichever system you use, it is crucially part of that risk assessment. It should be included in the output. So this is like the weather these days, where the weather channels now say there is a 50% chance of rain at 1 o'clock today, but what they don't do is give you the important information which says, and there's only a 10% chance this forecast is right. And that's the important the policymakers really need. So just to summarize, risk assessments often have to be undertaken very rapidly and on very poor evidence. This is often under intense professional, political and media attention. Good scientific evidence should still underpin the risk assessment processes and the resulting guidance. Evidence. Gaps in knowledge and assumptions need to be clearly outlined in the risk assessment, and confidence or uncertainty gives the overview of the quality of that evidence. And ensure complete documentation of the process with clear version control, because this acts as a log for your decisions and actions, and the decisions become easy to explain and justify, heaven forbid, if there is an inquiry or if somebody starts reviewing what you put into your risk assessment, as is increasingly happening these days. So risk assessment should be transparent, systematic and objective, rapid and reproducible, and once you've got a system, you can easily go through and review it quite quickly. It also identifies the need to move to an expert formal risk assessment. Don't be afraid to say, this is huge, this is going to be big, we need an expert formal panel here. It's used to promote risk-informed decision-making, and most importantly, any risk assessment should be communicated. There's no point doing them if you don't tell anyone what's happening. And this is obviously done, best done in a multidisciplinary cross-sectoral team who then sign up to the risk assessment or any risk statements. There are always a few downsides with risk assessment, and just a word of warning, sound objective risk assessments do not always result in appropriate policy interventions, actions, guidance and reports. I think all of us who've been working in risk assessments for a while realise however good your risk assessments, it may not have the actions you expect. And this is especially difficult for low probability, high impact events. It depends on whether your managers, your policymakers, your government, your ministers, it depends on their risk appetite. Some have a very risk appetite, and others are slightly more bullish about events. And often a lot of the risk assessments we do at a higher level are about managing expectations rather than the risk. And beware the risk of risk assessments. If your risk assessment goes well and it turns out to be true, you're in favour. If they go wrong, you will be forever named. But risk assessments underpin most animal, public health and environmental issues. But I think ensuring they're evidence-based and they're robust and they're shared by the multi-sectoral group that devises them, then you're minimising the risk to yourselves, which I think now you all have to bear in mind. I think that's my final slide. We're glad to hear.
Yeah, I was just about to do a quick reminder. Thank you so much for that fantastic presentation, Dilys. Really insightful, and I'm hoping that colleagues on the call, if they have more questions, please use our Q&A function. Just at the bottom of your screen. We'll be able to take a few questions from the experts right after the presentation. So please put some of your questions in the Q&A function, and the experts will be able to provide some insight. So next, I think we have the opportunity, we've had the opportunity to learn a bit about rapid risk assessments and the why, the when, and the how. We will now move to Ryan, who's going to be speaking a bit about the JRA operational tool from the tripartite. Over to you, Ryan.
Yes, sorry, I was muted. Hello, everyone. I'm Ryan Aguanno, veterinary epidemiologist at FAO in Rome, and I'll be going over joint risk assessment, and that's at the human-animal environment interface. So I've got quite a few slides, but obviously don't have too much time, so we'll get through as much as we can. So first, I wanted to just introduce you to the joint risk assessment operational tool. I'm going to be using two of the same terms, basically, joint risk assessment and the joint risk assessment operational tool. So joint risk assessment is a process of performing a sectoral risk assessment. But the actual tool we've created is the physical tool itself. So the physical tool, the operational tool, was published in December 2020. It was the first tool within the Tripartite Zoonosis Guide. And it's now available in those languages you can see on the right side of the screen. Those are the 6 UN languages, plus officially translated into Thai. So this is key principles for joint risk assessment itself, not the actual tool. So first I wanted to go into why do we need joint risk assessment? So the reality is that we have technical staff from different sectors, and they are trying to assess the same hazard. And when they're trying to do that assessment, they will generally estimate the risk of that hazard differently. So an example risk assessment question could be, what is the likelihood of a zoonotic influenza infecting a person and infecting an animal? And from the animal health sector, those experts may say the likelihood of infection for poultry is high, and the likelihood of infection for humans would be moderate. And from the human side, human health side, they may assign a likelihood of low for poultry infection and a likelihood of high for human infection. And that's just due to bias in their experiences and how they're perceiving the risk or the likelihood. And that doesn't even start to take into account how those different sectors may start to view impact, and I haven't even included the environment sector, which is just as important. So there is a need to do joint risk assessment because when we are talking about zoonotic risks. And so these zoonotic diseases require a joint approach to risk assessment. And why? And that's because all relevant stakeholders are required if we're going to fully understand the hazards arising at the interface. And when we have all of the relevant sectors, so we can summarize those as the environmental, animal health, and public health sectors, when they're all at the table, they can collectively evaluate where and why risk exists. And that's using their expertise and data that they're each gathering from their own sectors. And we're minimizing unintended impacts by understanding and addressing the perspectives and needs of each sector. So when we're also getting into managing the risks later, those unintended impacts can and so getting into now the actual creation of the JRA operational tool. So can we just use existing risk assessment tools jointly? And the answer is no, not easily or appropriately. So their joint methods and approaches are required to fully understand the hazards arising at the interface. And there are similarities to a lot of the sector-specific risk assessments, but they may operate differently. They've been created and they've evolved to meet the needs of specific sectors. They don't directly align to support expertise and data gathering from the sectors. And it can cause confusion when sectors have different approaches to foundational risk assessment principles, such as risk pathways, impact, uncertainty versus confidence, etc. And so basically a lot that this comes down to is a lot of us in our own sectors have specific practices that we follow, including specific language and definitions that we follow, and those do not translate to the other sectors. And so it's very difficult to bring other sectors in to perform a risk assessment using tools that existed previously. And that's why the operational tool the JRA operational tool was created. So now I'll introduce the operational tool itself a little bit more closely. So the JRA operational tool was built from existing tools and resources available across the tripartite. Sorry about that. And so now we do have the quadripartite. So with UNEP included to strengthen the environmental sector's influence and participation in this. But the JRA was created when it was just the tripartite, but with certainly taking into account the environmental sector. And so it is a standard tripartite operational tool. And the JRA operational tool allows technical staff to conduct a joint qualitative risk assessment at the national or subnational level. And Dilys went over some of the differences between qualitative and quantitative risk assessments. One reason that a qualitative risk assessment methodology was chosen is, again, because we are bringing in different sectors, people with different expertise. It is important to try and facilitate things by making them as easy as possible. And you're going to have lots of different data when you're conducting a multi-sectoral risk assessment. And so the qualitative methodology is a lot more flexible in allowing the different sectors to come together and participate. The way it works is that it's assessment of a single hazard at a time, and it uses existing technical knowledge and available data. And so that means that you can bring your unisectoral assessments, if they've been performed on that hazard, to a joint risk assessment, and that will come up in some future slides. It can be iterative, so it can be repeated and updated. So it's not necessarily a rapid risk assessment as Dilys covered as another methodology, but we see this being done iteratively when new data is made available, though it can be done quite quickly due to its somewhat simplistic nature. It very much does not replace sector-specific risk assessments, though. It was not created to remove those from our practices. So the sector-specific risk assessments, as I explained in the slide about those, they have a lot of uses and they have been created to suit the needs of those sectors. And a lot of risk management and communication may still exist within those sectors, of course. So there's a place certainly for multi-sectoral and unisectoral risk assessments. So information from sector-specific risk assessments informs the JRA and vice versa. So you can take your joint risk assessment outcomes and outputs and bring those to a unisectoral risk assessment in the future to strengthen that. And so that's basically what this slide is saying. So the benefits that we've seen from the joint risk assessment operational tool, and you will have, I think in the next session, some practical operationalization of the JRA in some countries. But from what we've seen is it creates a national structure and approach for conducting joint risk assessments at the national or subnational levels. It identifies joint hazards. It involves all the relevant sectors in the technical risk assessment. It allows decision makers to implement evidence-based approaches for risk management and communication. It fosters regular communication amongst the sectors. So in some cases, it's one of the first ways that regular communication across the sectors has been created. And it helps identify missing information and knowledge gaps that can then be filled in iterative iterations. So just very quickly, some technical development and piloting of the JRA. So there's the Tripartite Zoonosis Guide, which is a guide that was created with a variety of tripartite tools. And you can see some of the tools on the left side there. And the JRA is actually the first tool that was created within the Tripartite Zoonosis Guide. There have since been 2 other tools that have just been published. And then the tripartite and quadripartite will soon be working on completing the other tools over the next few years. So as I've said, there are 3 tools that have been developed. Along with the JRA, there is the multi-sectoral One Health coordination tool, and then there is the surveillance and information sharing tool, and of course I won't get into those right now. Here's just a few photos of a JRA in practice. So it's run over a workshop. And these are the countries that we've completed workshops in up until March 2022. So several, I think it's roughly 20 countries. A variety of zoonotic hazards have been covered. So just a list there of some examples. And we are, again, looking at these hazards at the interface. So as we're looking at the likelihood and the impact of transfer from either humans to animals, animals to humans, or various hazards from the environment to animals or to humans. And then just quickly, so you can see the workshop agenda, we do a training on day 0 of what the tool is. Then on day 1, we actually get into the introduction with all of the stakeholders there. We perform the risk assessment exercise on day 2. And on day 3, it's presentation and finalizing into the template that's available with the tool. So I think that's all we have time for this 10-minute overview. But there are 10 steps that can be made available for you to see, and those go over the entire tool. Thanks.
Thanks a lot, Ryan. I was just about to pop up to give a reminder. A really succinct and insightful presentation. I'm sure that many of the colleagues have questions around, and I can see some of the questions already. Thanks a lot for sharing that with us, and definitely looking forward to having more African countries go through this GRA process. Up next, I will now have Armelle to wrap us up. And I'm so glad that a lot of questions are coming around what multisectorial really means. I'm really glad to have someone bring in the environmental, what are sort of inputs into our discussions. I'm hoping participants will be able to learn about this sector and how we can incorporate it in our work. So over to you.
Is it okay for all of you? Yes.
Yes.
So thank you for all of you, and especially Scott, Adam, and Dr. Tieble to organize, and Yewande also to chair this session. So it's my pleasure to share with you some innovation that were already, how to say, accelerated by the COVID pandemic, but also during the 8 to 10 last years, and to replace the water cycle as a key piece of the One Health. Of course, we can also consider that we can have a vision for tomorrow, considering the water cycle epidemiology. So I will just, excuse me. Well, it's better. As you all know, Hugo told more than 100 years ago that the sewer is the conscience of the city, and all is, how to say, converged, and in that livid spot there are shades, but they are no longer secrets. So the water cycle is just receiving all what is emitted and circulated by human activities and also animal activities, but we are also exposed to the water that is constitutive for 70 to 80%. So very quickly, I just want to share with you a very short overview of the different lessons for the COVID with regard to the pathogen side, and in the second part we can just have a brief overview also of what has been done with regard to the chemical exposure and the chemical mixture exposure. So the wastewater-based epidemiology today is considered as a key piece also of the One Health, and especially during the COVID pandemic lessons, a lot of scientific experts worldwide have selected some biomarkers. The wastewater or the water essential services and water operators have also worked on making some, how to say, the right level of the sampling of the sewer to the sampling strategies, also developed strong statistical analysis of the data, to link monitoring data with clinical data, and also to improve the monitoring for the wastewater in an expert lab, but also real scale. And all that has enhanced at EU, but more or larger scale also with WHO, replaced the wastewater-based epidemiologies to be coordinated between public health authorities and territories, and also provide a complementary tools in terms of public health metrics in order not to duplicate some specific strategies. So it's also a way of saving public expenses, because we can have a early detection, tracking, managing, monitoring, and also risk assessment, and put also the burden upstream. So the relationship between the different partners is also a very key stake and key piece to coordinate this data discussed with regard to public health action. Excuse me. So the future of environmental monitoring now is allowing to have a key piece of early event detection, outbreak dynamics, and also developing some non-target screening on the wastewater-based epidemiologies for not only the pathogen, but also for the chemicals. And we can use now the raw water or the raw wastewater to how to so better assess human health and AMR, the treated wastewater with regard to environmental health and resource protection, as well for the resurface water. We have some specific biomarkers for human, animal, and environmental health along the territories, the water cycle, including all the water treatment plant, drinking water, wastewater treatment, aquifer recharge, and alternative reuse schemes. So we can, of course, have specific biomarkers to track the pathogens, including, of course, the COVID, but a large panel of all other pathogens, the glass that you all know, but also specific monitoring for pharmaceutical residue in the water cycle. And as we can just have a brief overview later, all the endocrine toolbox and more in a more larger scale effect-based monitoring in water safety planning, including the exposure to water chemical mixtures. I don't know if maybe I forget something. So we can see that we have multidisciplinary expertise that are been completely, that have evolved, that have been shared and validated at different, with different institutional bodies like WHO and also EU Commission, but more in a larger scale also with Canada EPA and also US EPA, and all this kind of expertise are combined to provide a more proactive, predictive, and protective way to use and to replace the water cycle in the piece of the One Health. So the key challenging question now are what are the challenges for the low and income countries, specifically with the countries that are now completely the same level of sanitation, of course. So, but anyway, we have to empower the cities to own and sustain sanitation system, and also to develop institutional and member state capacities. So that was very brief with regard to the COVID lessons, but I just want to share with you very briefly what has been done during the 8 last years at international level, because also with regard to the chemical pollution and the chemical world, we had a very, how to say, strong added value in terms of early tracking to risk assessment, considering the water chemical mixtures. So very briefly, one of the last key European funded project solutions aim to support and develop the European strategy for a non-toxic aquatic environment. And just for your information, the Water Framework Directive at EU level consider 45 priority pollutants. That is this little point. And this, how to say, this picture only shows that we can detect a key river basin at European level between 70 to 100,000 detected pollutant, chemical pollutant from all kind of origin, pharmaceutical, pesticide, and etc., perfluorates and so on. And all these compounds are detected at sometimes very low dose level, and they absolutely are not considered in any policies. So we had this way to see what was the emission of this pollutant on the river basin, their current and future use. We assessed and compared and benchmarked more than 150 cell-based assays, ecotox assays, and human cell-based assays. And we also assessed the different toxicological profile triggered by this complex priority mixtures. And then in a second way, we applied modeling tools to assess on river basin scale the emission of the pollutant, the toxicological profile of the emittents, and of course it was absolutely to support the decision maker in terms of better abatement option. So just very briefly, we use alternative testing strategy that were supported by all these institutional bodies that are integrative to the mixtures, that are also providing to more rapid, efficient, cost-effective, and more comprehensive biosystem for human and ecotoxicity, and to detect early toxic pathways that are triggered by the chemicals. We can have, of course, endocrine disruption, but also adaptive stress mode of action. And we can now have we developed some endocrine toolbox to assess estrogenic, androgenic, TR, GR, all the endocrine disruptive pathways. The same for the toxic mode of action triggered by the chlorine residual in the network. And we apply that on different water treatment schemes and different countries for realistic plant, but also unrealistic river basin. All this innovation have been implemented in the Water Directive revision, and just recently, we finalized and we restituted a proof of concept project to embed effect-based tools in water safety planning, and also having more than 15 countries and more than 50 treatment plants. So just briefly, because time is very short now, if you want to have further elements, we also derived some effect-based trigger values in order to better protect even human health or ecosystem health, and considering the mixture effect because it's completely different to substance-based approach. And we also derived some water chemical quality classes in terms of safety assessment framework, so we can detect the different mode of action. We derived some trigger values and also can derive some risk quotient, and derive some water quality classes and support the decision maker, the water treatment operators and territories to make evolve the treatment processes. So that is my last slide. So of course it was very short because it was a very brief overview of what has been done at European level, but also in a more larger scale in a Global Water Research Coalition with more than 25 to 30 international partners, academic, scientists, institutional bodies, and so on, and also with WHO in the board of this project. And you can, of course, come back to me for further questions and so on, and better understand and discover what are the added value of these effect-based tools considered as exposure-based, hazard-based, and risk-based assays. So it's my last slide, and it's the last one. I also want to share with you that all this kind of innovation allow us to replace the water cycle as a key piece of One Health, and also enhance the societal and institutional acceptance and acceptability of the reuse scheme with a more enforced safety framework, but also allowing to better protect water resources. And of course, if the human genome is completely under chemical fingerprint, we spoke about chemical exposome, it's exactly the same for all the biodiversity. So it's also a way of, we can promote this innovative early tracking tools and risk assessment framework and communication to promote One Water, One Health proof of concept. Thank you for your attention, and sorry to be so fast.
Thank you very much. I think we gave you quite a difficult task to talk about such a deep topic to all the panelists, but you have all done a fantastic job and just trying to put the right information within the 10 minutes. So thank you so much. Very quickly, what we will try to do is have 5 minutes of Q&A, but the panelists will still be online, so they'll be providing their answers. They're going to type their answers to you, but we will take a few questions. So starting off from Dilys, the question is how do you communicate risk assessment for a new risk where you have very scanty information, and how can we inspire confidence in a stakeholder when you know that it's kind of a tricky situation? I see that you've flagged that for your answer, so the floor is yours. And Ryan, I'll come back to you for one question as well. Dilys? Yeah.
Yeah, you're right. It is very tricky. I remember when we were doing Zika was emerging. The whole of the West was in a great panic about it. There were 3 publications at the time that gave evidence about Zika and Zika transmission, and WHO, US CDC, Public Health England, who we were at the time, Canada, every European Centre for Disease Prevention and Control were all using the same 3 publications and came up with completely different analysis of the risk of sexual transmission and therefore guidance. And it was very difficult to hold what we thought was the best advice, but we just, reiterated the guidance based on the evidence. But it is very difficult because everyone interprets the evidence differently. I think be consistent, admit when you've got it wrong. I think people will lose confidence in you more if you persist with your assessment in the evidence as it changes. So I think you have to be honest. We explained we didn't know what the gaps were. We didn't know what there were these uncertainties, but based on the evidence and our expert opinion, this is what we felt the risk was. And then as it changed and as it evolved, be prepared to revise your risk as the best way of keeping confidence, and keep people informed as to why you are changing the risk and what is based on.
Thank you very much for that answer. Ryan, I know that you might you have typed the answer to this, but I think it would be potentially beneficial, especially the fact that we have several operational tools. But someone on the from the audience has sort of flagged the question around the difference between the GRA operational tool and the US CDC One Health Disease Prioritization tool. So Ryan, I know you've put your answers there, but if you could just say it out to the colleagues so they could benefit from that.
Sure, yes. And so as I put in my typed answer, I've not been involved in a CDC disease prioritization workshop. But I know those are very much about prioritizing zoonotic diseases in the country. And I know they've been done by a lot of countries, and that means those countries have then been able to, say, focus creating surveillance plans for those diseases because they've been prioritized as maybe the highest impact diseases for that country. But that's different than the benefits of performing a risk assessment for a disease, where I just put an example that maybe there's a specific reason a risk assessment may be wanted, and it's not necessarily prioritizing those diseases. But if you have an outbreak of a disease in a neighboring country, you may want to perform a risk assessment to assess the risk of spread of that disease into your country. And so a risk assessment is also a lot on working with limited resources when we're trying to manage diseases, and really focusing in on, say, geographic areas, maybe timelines, or specific situations of when you'd want to start to manage that disease. Hopefully that helps a little bit for that specific comparison between those two tools.
Thanks a lot. One final question, quite interesting, and this is to you, Dr. Hebert. Supposing we do away with one of the vectors or reservoirs, I'm guessing disease reservoirs, what will be the impact on the ecosystem generally? If you'd like to, please provide some answers to that question. Over to you.
Oh, you're muted.
Oh, excuse me, you are speaking about pathogen reservoirs.
Yes.
Okay. Maybe my expertise is more focused on the chemical part, the chemical context, and I don't know if my answer will completely be aligned to this question. But the point I would like just to exchange with you and also to drive attention is that the chemical fingerprint on all the genomes, human, animal, vegetal, biodiversity genomes, is providing a strong fingerprint that can cross many 2, 3 to 4 generations, and they can have very important impact of the gene disruption on the gene expression and all the body system, the immune system, endocrine system, reproductive system, nervous, central nervous system, and so on. And it's the reason why, especially with regard to the immune system that is completely impacted by the chemical fingerprint that can reach the genome, the cells, during embryogenic or fetal exposure, that can also deplete disrupt the immune system and also weaken all the organism with regard to the pathogen infectious. So it was a point just to exchange with you that chemical exposure and biological exposure are completely also linked in terms of how organisms are able to react and to be able to fight the different infectious disease. And of course, if we can reduce the chemical load on the water cycle by a more comprehensive and robust diagnosis and monitoring and safety framework, we can reduce the organic load and also the pathogen loads, and by the way, by chemical reduction, also the AMR. So I think it was also one of the reasons this kind of presentation with regard to the chemical side, considering that the water cycle is crossing on all the bodies, the livings, but also the territories, is absolutely important, also linked to the AMR and the pathogen reservoirs, because if we do not consider and address the chemical load carried by the water cycle, I think the organism will keep and will become weaker and weaker with regard to infectious disease. So maybe I hope that this answer can also just provide a more larger overview. But I just have maybe one very short point in addition. I didn't get into details with regard to the different health adverse outcomes related to this chemical exposure, because they are determining a lot of chronic disease during the 1,500 first days for conception to early life. And in 2015, we had about 155 billion euro per year for Europe, but the double for the US, only related to endocrine disruptors that are all these chemicals. And this cost assessment has not been done for 1,000 countries, but South Africa is especially very committed in the endocrine disruptors and health-related outcomes. So we can further exchange on that. But the link between the pathogen, the chemical and pathogen risk are very, intimate. Thank you for your attention.
Thanks a lot, and I'm really grateful for your answers. Quite interesting, and I'm sure that there are several other questions popping up. Please, participants, note that our experts are still on the panel and will be able to type some of their answers to give you some guidance. I'm really hoping that you enjoyed this first session, and I'll now hand over to my good friend Tieble to carry on the next session. Thank you so much to my distinguished panelists. It was a great session. Thank you. Bye.
Thank you very much, Dr. Alimi. Really, this is brilliant moderation, and thanks to all the speakers as well. Brilliant information. You outlined very well the principle